Hi, my name is Shirin, pharmacist. I'm really pleased to speak with you today on this important topic of medications and memory. I have no conflicts of interest, but I do have an abiding interest in the health and wellness of the seniors in our community. Memory loss and drug side effects are amongst the top-ranked health concerns for older Canadians. And we've all experienced that forgetful moment when we go into a room and we don't know what we came in for, or we forget those keys yet again, or that embarrassing moment when we are about to introduce someone and the name is on the tip of our tongue, but we can't quite remember. And that perhaps happens to many of us now and again. But when we experience these forgetful moments, sometimes we worry that perhaps it portends a more serious condition. And so over this next half hour or so, I'd like to discuss the potential causes of memory changes and some of the mitigating factors and the evidence behind that. We'll look at polypharmacy, multiple medications, and the risks that that poses to the older adult, and identify medications that may affect memory. And then we'll look at the careful deprescribing of inappropriate medications, so the stopping or reducing of medications that may be harmful to the older adult as a strategy to preserve brain health. But first, I'd like you to meet Mary. Mary is 72 years old, and she's been struggling with her memory. She describes it as her memory is playing tricks on her, and she has a hard time remembering. And if truth be told, she's also a little bit confused and not sleeping well. Her anxiety really is whether she's got something serious like Alzheimer's, or is it normal aging, or is it some other concern that she should be worried about. And charts like this, like from the National Institute of Health, provide some reassurance that really missing the odd monthly payment or forgetting sometimes a word or a name or the day, losing things from time to time is really nothing to fret about. But serious memory problems like Alzheimer's come with serious symptoms and consequences. And if you're really concerned about your memory, then it really is best to speak to your doctor, who can do a thorough medical history, a medical exam, including a neurological exam. So let's examine the many causes of memory loss. Aging certainly can impact, as can medical conditions. So if you've suffered a stroke, or you have depression or some sort of a dementia, certainly that can impact memory loss. Stresses of all kinds, sleep deprivation, that's a big one as well. That can really play havoc with the memory. Nutritional deficiencies like vitamin B12, that can also cause memory loss. And so that's something to also keep in mind. Head trauma, of course, that's an obvious one. Substance abuse, and here I'm talking about alcohol and smoking and drugs of abuse. And then lastly, but importantly, medications, and they can be a culprit as well for memory loss. When we look at the aging brain, mild forgetfulness is normal. Now we know a lot more about the brain than we did in the past, and the research continues. What we do know now is that what we thought then rather is that the brain develops at a very early, in the early years, very rapid pace. It then sort of peaks and then it declines after mid-age. What we now know is that the brain continues to grow, to adapt, to grow new neurons, rather new networks, new connections throughout life. This neuroplasticity or rewiring of the brain continues and is possible throughout life to learn to readapt even when there is injury to the brain. Now, some of the common changes in the brain, and we know that some areas can become less efficient. So, for example, the hippocampus can shrink. That's a part of the brain that is one of the parts of the brain that is involved in memory and attention, and that can decrease your processing speed, your finding a name or recalling things, multitasking. But we also know that the brain remains stable in many areas and in fact improves in some. There's an increased depth of accumulated knowledge, skills, and ability. And the brain, the neurons, actually, the branches of the nerves, or dendrites, are actually able to connect better in the aging brain to distant parts of the brain. So that means that an older person may be able to connect the dots better to see the big picture consequences of things, to see the forest, if you like. And as they say, with age comes wisdom, this wisdom. Mitigating factors, a healthy, balanced lifestyle protects your brain. So really, these are factors that are the antidotes of the very things that cause memory loss. So eating healthily, as the World Health Organization puts it, Mediterranean mind diet, managing your medical conditions, reducing stress, ensuring that you're not sleep deprived, avoiding substances of abuse, socializing, and being active, exercising your body and your brain, engaging in stimulating activities, and assessing your medications. And when we look at the research out there, recent reviews have indicated that the research does indicate that by keeping active physically, exercising regularly, you can actually decrease your risk of cognitive decline or your thinking skills, your memory, by about 38%. And keeping active mentally as well improves your and maintains your memory. The Mediterranean mind diet, and here I'm talking about lots of fruits and vegetables, nuts, fish once a week, berries, and keeping away from saturated or minimizing saturated fats and red meats. So really looking at the causes behind the memory lapses, and also, could it be your medication? Well, Mary actually is asking if she can take something, take a medication to help her fix her memory. She's been made aware of the evidence around the healthy lifestyle, and she promises that she will, because she has been rather sedentary and she enjoys her tea and biscuit diet. So she's going to try out the Mediterranean diet and she's going to get moving. But she wants a quick fix. And unfortunately, there isn't one, because when you look at the evidence behind, and there's a recent systematic review of trials looking at different types of products out there, vitamins, omega-3s, even ginkgo biloba, and the evidence really is insufficient or of low strength. And with things like ginkgo, you also have to be careful if you're on blood thinners, because, and that's one example of a side effect where there's an increased risk of bleeding. Well, what about prescription medications, Mary says, because she knows that if you have Alzheimer's, and she says, I know I don't have Alzheimer's, but, you know, what about those medications? Will that prevent me from getting Alzheimer's? And no, they do not. There are medications out there, cholinesterase inhibitors and NMDA inhibitors, as they're called, that increase the level of messenger chemical called acetylcholine in the brain. Acetylcholine is important for memory and attention. And by increasing the level of that chemical, by decreasing its breakdown, you're actually going to improve, hopefully, attention and memory and cognition. But in fact, only modest benefits have been seen in people with Alzheimer's and dementias with these medications. And certainly they will not reduce, to Mary's question, the risk of dementia in her case. Well, let's look at the way that the body processes medications as we age. And we know that the body processes medications differently when you're older, for the simple reason that the brain becomes more sensitive to the effect of drugs. There's higher body fat, less lean body mass, less water in your body, less fluid. Your liver and kidney function is not working as efficiently. All of that means that your body will not process medications as efficiently. Medications might accumulate, might become more concentrated, might stay around in your body for longer, which means that you may have to reduce either the dose or the frequency of your medication, or you might have to switch to a safer medication. Well, let's look at Mary, and she brings in all her medications. We discover she's on quite a few medications, on a blood pressure medication, a sleeping pill, an antihistamine, Gravol, which we all know, a pill for her muscle spasms in the back, and she's been on an antidepressant for a very long time as well. And taking a lot of medications, or 5 or more medications, or taking more medications than you need, is called polypharmacy. Polypharmacy is a concern because the more medications you take, the more the risk of side effects. And Mary is not alone. In Canada, the proportion of community dwelling seniors that take 5 or more medications is 66%. 10 or more medications, almost a third. And the proportion of 85-year-olds who take 10 or more medications is a whopping 40%. Those that are most at risk are those over the age of 65, women, because they process things differently, and people with multiple chronic conditions. And unfortunately, with age, some of us will accrue chronic health conditions which necessitate taking different medications. The problem with polypharmacy, taking more medications than is necessary, really leads to more side effects and interactions, one medication with another, or prescribing cascades. This is where one medication is actually being prescribed to counteract the effect of another medication. Falls and hospitalizations increase with polypharmacy, as do costs. And the Public Health Agency of Canada had come out with a report on falls in seniors. Many causes, and specifically pointing to psychotropic medications, medications for sleep, for anxiety, for depression, that significantly can increase the risk of falls. And they advocate gradual supervised withdrawal from these medications in older adults. Okay, so let's now look at how medications can negatively impact cognition and memory. And these first two, medications that decrease that chemical that is critical for attention and memory, one of the chemicals, acetylcholine, that I just mentioned, are called anticholinergics, or have anticholinergic effects. And they can play havoc with your memory because that acetylcholine level is now much reduced. Sedating medications, sleeping pills, can play havoc on your memory. And these two, if you're on these two medications, one or more of these medications, you really are at risk of cognition and memory impairment. And this is measured by something called the drug burden index. The greater the number of these medications, the greater your drug burden index. But medications can also affect memory in subtle, in different ways that you might not expect. So for example, some medications can cause vitamin B12 deficiency. And we know that B12 deficiency can actually result in some memory issues. So metformin, for example, is a diabetes medication, a very good medication for diabetes. and it causes B12 deficiency or can cause B12 deficiency. Well, do you stop that medication? No, you would, in that particular case, you would probably monitor the level, and the metformin being needed for your diabetes, you'd probably take a supplement of the B12. But sometimes people are on ulcer medications called PPIs, proton pump inhibitors, for far too long, and that can cause B12 deficiency. That might be something that you can take off gradually. Uncontrolled medical conditions like high blood pressure or high blood sugar levels, as in hypertension or diabetes, can actually play havoc, as can the medications that reduce it if it reduces it too much. So if your blood pressure is reduced too low, simply because the dose of that medication is too high for you, then that can also impact your memory, and the same with blood sugars. And then there are medications that will increase or could increase the risk of stroke, such as some painkillers like Voltaren, diclofenac, or antipsychotics. Let's just look at anticholinergic effects for a minute. So these, again, are medications that decrease the level of this chemical neurotransmitter, this messenger chemical, acetylcholine, which is really important for many functions in the body, muscle contraction, for example, and so on, but also for memory and learning. And so side effects of taking anticholinergics, particularly exaggerated in the elderly, are agitation, sedation, confusion, delirium, memory impairment, as well as a host of other side effects like dry mouth and blurred vision and constipation. So much so that the 5th CADeN Consensus Conference on the Diagnosis and Treatment of Dementia talks about anticholinergic medications and advocates and warns against using those in older persons, and to think about alternative medications, and also to rationalize medication use by making sure that this health assessment is conducted, including use of appropriate medications. So when we look at the impact of medications on memory and cognition, and here we're talking about, so again, anticholinergics, those with that decrease the level of acetylcholine, or sleeping medications, for example, they will affect short-term memory, long-term memory, laying down of new memory, retrieving old memory in storage, that can be impacted, your attention time, the reaction time, and coordination. So you can imagine the risk of falls there. The executive skills, that planning, that concentration that you need, that is also impacted with medications such as sleeping pills, such as the anticholinergics. This is a colorful diagram that shows different nerve pathways, neurotransmitter pathways that are involved in memory and attention and response time and cognitive or executive function. And you can see that there are many different pathways that release different chemical signals. One of them is acetylcholine that we talked about, but there are others like histamine and GABA, and also opioid pathways. And all of those will affect memory, attention, executive function, alertness. Some examples here, and some of them are seemingly innocuous. I mean, antihistamines are things you can buy off the shelf, over the counter. They're used for allergy and nausea and rash, and also in sleep aids, such as Gravol, dimenhydrinate, or Benadryl, diphenhydramine. And these can play havoc in the older adult's brain, where the acetylcholine is already low, and the histamine actually decreases because it has anticholinergic properties. And then you have sleeping pills, which again damp down, like lorazepam and zopiclone. And anticholinergics come in all shapes, really a wolf in many sheep's clothing, if you like. So you'll find these anticholinergic side effects in medications for depression, for psychosis, even for bladder problems or nausea, or stomach cramps or muscle relaxants. And then opioids or narcotics, all narcotics, codeine, morphine, fentanyl, all of them can impact memory. This is a busy slide, but it's from an infographic that you may wish to look at from the Canadian Deprescribing Network that's called Medications and Memory and Medications. And you can just see a vast range of medications that can impact memory and brain function. And these are called potentially inappropriate medications, or PIMS, as sometimes known, where harms clearly outweigh the benefits, particularly in older adults. So let's look at Mary and her slew of medications. Apart from the blood pressure medication, because her blood pressure is actually quite well controlled, she's on a number of medications that have anticholinergic properties. The antihistamine, the medication for muscle spasm, the antidepressant have anticholinergic effects. So they can cause confusion and decrease impact on memory and cognition. The sleeping pill, again, will impact memory and cognition. So 4 out of our 5 medications are actually, could be potentially really harmful. So we're now steering Mary away from her, is there a quick fix? What can I take for my memory pill, to, do I still need this medication? Is this medication likely to harm me? And here is another infographic from the Canadian Deprescribing Network. So what can be done? Especially if you have medical conditions and you need medications and you're not sure what you need to take and don't need to take. It really is a very fine balance. And therefore, what you can do is, what can be done rather, is deprescribing. Deprescribing is something that is never done solo, i.e. we would not, as an individual patient, stop a medication because we say, oh, we're taking far too many, I'm going to just drop this one and that one. We cannot do that. That can be really highly dangerous. But deprescribing, with the help of your pharmacist and your doctor, can actually help your health outcome, your brain health, and improve your quality of life. And deprescribing essentially is reducing or stopping medications that can actually cause harm. So the questions to ask then: set up an appointment with your doctor or your pharmacist, take all your medications, and these include medications that you have picked up off the shelf or you've picked up at the health food store. Bring them all and then go through them with your pharmacist. Ask if you're not sure, or confirm, why am I taking this medication? Do I need to take this medication? What are the potential harms and benefits of this medication? Can it affect my memory or cause me to fall? And can I stop it then, or reduce the dose of this medication? And who do I follow up with and when? So Mary, who's taking medications that clearly is impacting her memory and cognition, benefits from this assessment. And although she's reluctant at first about the sleeping pill particularly, she realizes that what is most important for her is to get her memory back. And so she's willing to stop all of these medications. And we say, whoa, not quite immediately, because if you're on a sleeping pill for a few weeks, you can actually get highly addicted, and you can only stop it by tapering it slowly, couple of weeks at a time, chipping away at it. And the Deprescribing Network has a very useful algorithm, a tapering algorithm that can be used. But this will be done with the supervision or under the supervision of a doctor. And the antihistamine, on the other hand, the Gravol, And when I asked her, what she's taking it for, it's really because her neighbor, who's about 30 years younger than her, says, oh, the gravel really works for me for sleeping. And so Mary, whose sleeping pill wasn't working as well of late, decides to add that on. Well, she says, that's the last time I take advice from anyone other than my pharmacist or doctor. And so she stops the gravel. The muscle relaxant is also stopped. She realizes she's been rather sedentary of late, and will benefit from some physio and massage to get all those kinks out and then move, really, whatever Tai Chi, yoga, walking, things that interest her. And the antidepressant that she's been taking forever, well, she needs to have an assessment of whether she still needs an antidepressant. And if she does, then another option is needed other than the amitriptyline, because all of these three, the antihistamine, the muscle relaxant, the antidepressant, all of them have anticholinergic properties. They decrease the level of acetylcholine. They will play havoc with memory and cognition. There's a number of useful resources as we get older. How to get a good night's sleep without medication is a good one. All of them actually are really useful that you may want to pick up. And Mary is particularly heartened by Mrs. Robinson's story because, and this is another infographic, and this is about Mrs. Robinson, who took lorazepam for 10 years, fell, luckily escaped with a few bruises, but then decides to really get some sleep therapy and taper herself, wean herself of the lorazepam under her doctor's supervision. And so she does, and gets her life back. And so Mary says, well, if Mrs. Robinson can do it, so can I. And on this happy note, then, I will end just to conclude by saying that we've examined the potential causes of memory changes. We've looked at the risks of polypharmacy and identified some medications that may impact memory. And then we've looked at the careful deprescribing of medications that might actually be harmful to memory and to cognition, and how we can improve brain health with a concerted effort, concerted assessment, and support from the pharmacist and the doctor. Thank you. If you do have any questions, please don't hesitate to ask and share them with us. The organizers will put any feedback you have and any questions that you have my way, and I'd be happy to answer any questions. Thank you very much.